Hello everyone. In this video, the continuation video of goniometer, we are going to see about the principles of goniometer. These are the major principles which we have to keep in mind while performing the goniometer on patient. The axis of goniometer has to be placed over the axis of the joint. Make the patient more comfortable and relaxed. Select suitable starting position in anatomy, that is mainly the anatomical position of the part which is going to be moved. The goniometer has to be kept at the 0 degrees before measuring or recording is done. The measurement part of the body has to be clearly and completely exposed, draping the all other parts which are not going to be performed the movement. The stationary arm is positioned at the longitudinal axis of the part proximal to the joint which doesn't move. The movable arm is positioned parallel to the longitudinal axis of the part distal to the joint which is going to be moved. The stationary or immovable arm should be positioned accurately in appropriate place to get the measurement accurate. Environmental variables also should be kept in consideration. Instruct the patient to avoid any sort of trick movement while taking measurement. The goniometer should be placed in such a way that it should not restrict the joint range of motion. The therapist should take comfortable base of support, either the walk standing or stride standing position. Principles of goniometer, which also includes the measurement, should always be taken from lateral aspect of the part of the joint in order to prevent obstructions. Measurement of joint range may be done actively or either passively. Establish bony landmark for measurement perfectly. Stabilize the proximal part of the joint which is to be measured. Check both active and passive range of movement. These are the uses of goniometer. It is mainly used to measure the available range of motion in case of various physical problem that actually limits the joint range of motion. Measurement in alteration of joint movement is useful to treat the condition and increase range of motion of the joint. Passive measurement always gives the range of joint movement if the therapist moves joint passively, and in the active range of motion, if it is less than the passive range of motion, then actually it indicates the problem of the muscular weakness. This is mainly used to select the appropriate treatment goals, to record the progression and regression in rehabilitation aspects. It should be compared with normal range, and it has to screen. It can be used to screen the hyper and hypomobility of the joint also. It is used to screen the limitations of movement of particular range, to identify abnormal conditions related to muscles, tendon and joints such as contractures, decreased range of motion due to disuse or injury. These are the indications for goniometer. It could be for soft tissue tightness. The soft tissues which are related to the joints are muscles, ligaments, capsule, cartilage, synovial membrane, or the adhesions which happens inside the joints, which the lack of mobility of the joint reduce the flexibility and the nourishment circulation around the joint structures. Injuries or inflammation which also limits the joint range of motion can also be determined through range of motion through goniometer. The injury or inflammation which could be either due to osteoarthritis or rheumatoid arthritis examples. And the muscle bulk, increase of muscle bulk may also cause the reduction in the passive and active range of motion, can also be determined through goniometer. Females are more flexible while comparing the males, can be used for many studies, and the nervous system paralysis and hypomobility can also be determined. And in specific to say, joint injury, edema, pain, skin tightness, spasticity, adaptive shortening of any particular part, poor muscles or muscular weaknesses, joint stiffness, muscle tightness, contractures, deformities, all these can be determined for as the indications for goniometer. And these are the contraindications. To be specific, for general uncontrolled hypertension, hyperpyrexia and cooperative patient, and for the local contraindication, any recent fractures, recent surgeries, post-op surgeries, open wounds, unhealed scars, severe pain, joint inflammation, malignancies, joint dislocations or subluxations could be considered. These are the techniques which has to be kept in mind before applying goniometer on patient. Patient should always be kept in comfortable and relaxed position. Joints to be tested has to be or measured should be exposed without hindrance from clothing, etc. Position and stabilization should be corrected. Place the joint in starting position of 0. Therapist should always explain about the procedure to the patient so that the patient has a clear awareness of the movement or the joint which is going to be tested. Stable arm of the goniometer should be placed on the proximal and movable arm on the distal segment. Therapist should move the movable arm along with the joint movement. These are the things which has to be kept along with while performing the recordings of goniometer. Goniometer has to be perfect. The numerical tables, pictorial charts and written text for any evaluation. The important points which has to be considered while performing goniometer is the starting position for measuring all joint range of motion should be in the anatomical position except for rotation, which has to be performed in transverse plane of the body. Be aware of the position the body is supposed to be in for movement and any stabilization issues. Stabilize the part of the body that is proximal to the joint which is going to be tested. The patient do not allow to be move their body while moving the joint. This step isolates the joint movement for more accurate measurement, and there are degrees which has to be measured and recorded from 0 to 180 or 180 to 0 degree, or either from 0 to 360 degree or from 360 to 0 degree if it is a full circle goniometer. 0 degrees should be always be marked or ensured before starting the goniometer measurement. Consistently use the same stationary and movable landmarks in the body when measuring to ensure the consistency. The angle of movement from the stationary arm to the moving arm is read off the body and reported as the range of motion. Look at the reading on the goniometer at eye level before removing it from the patient body. Be sure to record the range of motion of the joint and compare the reading always with the contralateral side. These are the limitations with respect to the goniometer. Reliability dependent on examiner's experience, as it is a subjective one which is more reliable on the examiner's experience, and the reliability varies on joint which is going to be measured. It requires consistency in positioning, stabilization and alignment of the segment which is going to be examined. Some disagreement between the source of normal values of range of motion, slightly difficult to measure at spinal joints.